Good morning, everyone, and thank you for joining us today. My name is Sonia Bowman, and I am the Executive Director of the Construction Industry Alliance for Suicide Prevention. Today, we're going to have a conversation with my four esteemed panelists on mental health and suicide prevention in construction. For us, we really like to call this the next dimension in safety. So if you'll indulge me for a few moments, I will pass the mic around to the panelists and ask them to give a little bit of an introduction, and then we'll launch into some questions that we have pre-prepared for today and a conversation for you. If you do have questions for us, please feel free to put them in the Q&A. The chat will just be for the panelists today, and we will answer them at the end of the presentation. So Nick, I'm going to ask you to start off, please, if you don't mind, and give us a brief introduction and tell us how you got to become a board member for the Construction Industry Alliance for Suicide Prevention.
Sure, thanks, Sonia, and good morning to everyone. So my name is Nick Robbins. I'm an EH&S director for our East region for Lendlease. I worked for the company for a long time, 25 years almost, and probably at least 2/3 of that I've been involved in mental health, suicide prevention. I'm a safety professional, and this is a big part of essentially what I do. And I've been a board member for, I think, almost 3 years now, since just COVID, actually. Yeah, it was actually just prior, I mean, like immediately prior to COVID, and then everything changed. But yeah, so highly passionate about it, personal interest in it too.
Thanks. Justin, how about you?
Morning, everybody. My name is Justin Asbell. I am with Milwaukee Tool. I'm the director of National EH&S, and I'm happy to be upon the panelists here, as well as a board member of the CISP. I have been a safety professional almost 30 years, just turned over the 28 year, which seems like yesterday I started. So it just goes by in a blink. But any route, I entered the mental health advocacy in 2020. I myself went through a process nearly taking my own life, and very fortunate to overcome that process and get to where I am today, and being able to advocate for mental health in the industry as well as SUD. And I've been fortunate enough to be able to join the board about 6 months ago. So I'm glad to be here, and glad to literally be here, as well as glad to be upon the panelists and with all of my colleagues here. So thanks for having me.
Thank you. Jess, how about you next, please?
Yeah, thank you. Sorry, I had to get unmuted. I'm Jess Bunting, and I'm the Research to Practice Director with CPWR, the Center for Construction Research and Training. And if you're not familiar with CPWR, we're a nonprofit that is devoted to improving safety and health in the construction industry. And that, of course, includes mental health and worker well-being. And then I also personally have had a long time interest in mental health. I got my bachelor's degree in psychology, and I worked for a mental health association before coming to CPWR about 12 years ago. And so when the opportunity came up to join the CISP board about 1.5 years ago, I jumped at it, and it's been a great experience. So I'm happy to be here with our esteemed panel today. Thank you.
Thank you. Wes, I'm going to go to you next, please.
And again, thank you, Sonia. And I'm really appreciative to be here with Justin, Nick, and Jessica as well, because, this is an important issue. I'm the executive director of safety at the National Electrical Contractors Association. And, like Justin, I've been in safety for about 30 to 35 years, having taught electrical safety apprenticeship, OSHA safety training for many years. And about 10 years ago, I was invited to the national office here in DC. And one of the perspectives that I brought here was the actual field safety that, from a contractor's point of view. And I think they've really appreciated that, because we've been able to implement a lot of things. And when we talk about the health aspect of what we're here for today. I mean, going back as far back as 2016, from NECA's perspective, we had people like Stuart Benstock that actually spoke at our conference. But it really is about, you know, expanding that safety topic, safety communications, to include the health aspect. And now with mental health being so predominantly in the news with what we need to address, this is a perfect venue for us to be able to share some of those thoughts. So again, thank you, and I'm honored to be a part of this panel today.
Thank you. And thank you all for being here and being part of this discussion. I know that given the opportunity, the five of us could talk about this all day, but we'll try to be as concise as possible and start out by just a little bit of an introduction to those that are joining the webinar and may not have some background of what the Construction Industry Alliance for Suicide Prevention is or does. So I want to kick off with that and ask Wes, if you don't mind sharing a little bit of our history and some background of CIASP.
I like being the first one to answer this question because I'm actually the newest member of the Board of Trustees. So I think it's perfect that I talk about the history of the Construction Industry Alliance for Suicide Prevention. But, you know, really it was born out of a need. I mean, they had precursors that, you know, from the CFMA that actually started talking about this years ago. But from a study that the CDC, the Center for Disease Control, actually did, and identifying the construction and extraction operations actually had the highest percentage of suicides for an industry, that, you know, that's really what was the precipice for this particular organization to say, hey, there's a need. So in 2018, they developed a nonprofit, you know, 501c organization to address what can we do to actually get this message out to everyone, to actually provide resources, provide links, and much like we're doing today, provide outreach to everybody. You know, the mission is really to eliminate suicides in the construction industry, and we're doing everything within our power to provide the resources to the construction industry as a whole, whether you're union, non-union, it doesn't matter. It's about saving lives, and that's what the Construction Industry Alliance for Suicide Prevention is about.
Thanks, Wes. And if I could make a shameless plug, I would direct all of you to our website, which is preventconstructionsuicide.com. Also, please feel free to follow us on LinkedIn. We have lots of free resources there, anywhere from toolbox talks all the way through mental health assessments that you can jump on and take. So I just wanted to put that out there before we launch into our next question. And Wes, you mentioned that, you know, construction has higher rates of suicide than other industries. So I want to throw this out to you first, but then obviously invite anyone on the panel to answer this question as well. Why are construction workers at higher risk? What makes construction different or special?
Well, you know, I think one of the biggest challenges that we have in construction, I mean, the perception of construction, number one, is that it's a low skill trade. You don't have to really be educated in order to do it. Well, I'll tell you that I've had to go through a lot of education to become a state certified electrical contractor in the state of Florida. So it really is a highly skilled, highly technical industry that we need to understand. But that perception that exists, the people that go into construction, they really don't have any control. They're always told what to do. They don't have any say-so in what their actions are. And when they don't do what they're told, they get fired, they get let go. So it is that kind of, you know, the lack of control is one of the aspects that contribute to some of the suicides that we're talking about here. The other side of it is exactly the opposite, you know, in the sense that from the construction industry, you know, we work hard, we play hard, we do a lot of things. But we've also got that masculinity. We've got that tough guy image that, you know, we want to get the job done. We want to be the one that they can depend on. And it really puts a lot of internal stress, a lot of internal pressure on us to be able to perform. And when we can't perform, then, you know, that's really where we start considering these options that, you know, we know that suicide is a permanent solution to a temporary issue. And if we can keep people understanding that this is going to be temporary, it's going to be over with shortly, we can kind of address that and get their perceptions to, you know, to understand that there's alternatives, there's discussions, there's starting the conversation. And I think that, you know, again, from the construction industry, if we can kind of break down those barriers that are, you know, putting up walls for us right now, I think that, you know, we can make a dramatic decrease in the number of suicides that occur in the construction industry. And you know, Justin, Nick, and Jessica, I mean, what else do you have to say to add to that as far as from construction perspective?
I have something very topical, being as it's the Steel Erectors Association. So I was investigating what we term a critical incident short while ago. Iron worker. He fell whilst he was on the steel. Didn't fall off the steel, fell onto the steel, which actually probably meant that he got more injured than he would have done because we had nets underneath to catch him. But he fell onto the steel and drove his connector bar up through his armpit and out through his back, which was pretty serious injury, right? Well, he walked down, he took it out himself, walked down the steel, walked to the ground, got somebody to take him to the hospital. He was back at work. That was a Thursday. He was back at work on the Monday. The next day, on the Friday, I was investigating the accident and interviewed him. And he was very proud of his, the bandages and stuff like that. But he just wanted to get back to work. And, and it backs up that macho. And everybody was saying, well, he's an iron worker, And so iron workers, how I feel, and I'm you may notice from my accent, I'm from the UK. I heard all about iron workers in the States and all the rest of it, but I don't know that that's a healthy kind of environment when you consider the pressure that can put on people to return to work too early, and then potentially put pressure on themselves, pain management, all those other things that can lead to, anxiety, depression, and then ultimately potentially suicide. So yeah, it absolutely is that type of environment, and that's one of our biggest challenges.
If I could add, I started my career in 1994 as an iron worker in Kansas City. So sorry, Nick, I was actually the safety person's worst nightmare on the job. Hence that's how I probably got into safety. To be honest, in the construction industry, and our focus is like, why is there higher risk for suicide, right? I think one of the processes that going through mine was that really opened my eyes to what true stigma is. It really made me understand, because for the longest time, I think my perception of why people would end their life was due to like substance abuse and different processes like that. I had no idea of what real stigma was, right? And to put it into layman's term, it made really sense to me. When you get to a position, especially starting out, and you build upon your credibility, taking a risk to tell someone that you got stuff going on upstairs in your mind and you need to talk to somebody, it was scary. It was like, hey, I could get bumped off this job. I have a wife and daughter. I can't provide for them. So the financial aspect kicks in, and it made me, and I know it makes other people a little bit nervous about reaching out and asking for help. And then who do you ask that won't go tell the whole world, right? So understanding the stigma side is really important. And that's a real big part, especially in the construction industry, because I was brought up that pain makes you stronger kind of mentality, and that machiness, right? And it wasn't something that we were told, hey, it's okay to go talk to someone if you got some issues, where now that side of the industry is starting to change, where our own leaders in all industries are starting to say, hey, I had to get help. I'm doing better now, and it's okay. So you're seeing it from a top level down. So I think from the construction side, understanding the stigma side, that's why I think it's so high. And then the other side is people need to make money, and they will go to work in pain. And if they know someone they could buy an Oxycontin pill from, and make $400 that day to provide for their family, they're going to do it, because that's reality. And then what that leads to is SUD. So, I mean, understanding the processes in there and communication about that is so key. And I think that's one of the reasons it's such a high risk for suicide prevention in the industry is we're starting to really understand what's really happening. And now we're understanding how to communicate and build out proactive approach, resources for it.
Can I add just one quick thing to it? And we're talking about the construction industry here.
Yep.
And I know that the examples that we're giving to you right now are actually relate to a lot of the field employees. But the other aspect that we have to consider here is the construction industry, the management side of things, because there's just as much pressure, there's just as much stress in an office environment for a construction project manager. And we've had and has experienced, I mean, even our CEO in his previous life experienced some of their project managers that had actually died by suicide. So it's one of the things that, when you have, the stresses of is this job going to make money? Can I afford to make payments this month to the payroll? So, we have to look at how wide reaching that this particular issue is in the construction industry holistically.
Absolutely. Absolutely. Before we move on to our next question, Jess, is there anything you wanted to add to this conversation?
I think everyone did a really great job of speaking to the high pressure environment and the extreme stigma around mental health in the construction industry. And I think those are two of the main factors and the barriers that we need to address to be able to really make a difference in suicide prevention. I would just point out that I think someone said on another recent panel that we did, and I can't remember who, that if you look at the general risk factors for suicide, construction has most of them. And so even taking out some of the high stakes, high pressure, macho atmosphere, you have things like travel and separation from family. You've got odd hours, shift work, sleep deprivation, poor access to healthcare, all of these different things that play into this. And some of them are maybe smaller than the issues that we've been discussing, but we need to, I think, address this holistically. And I would just, urge everyone to consider those factors that lead to job-related stress and how many of them there are in the construction industry.
That's exactly right. And, you add in the pressure of seasonal work, you don't know, project to project, et cetera, et cetera. And, it is that synergistic kind of experience because there's so many of them that, most of them are smaller. And if they were on their own, you'd be able to cope. But when you add them all in together and then something changes, that kind of takes you over the edge, that's when you get into crisis. And that's why it's so high risk in construction. There's so many triggers.
Absolutely. And I think one of those risk factors that, is always one to consider is the chronic pain, and then the adjacent sort of mental health issues that come from having to manage through that chronic pain. So if we could, Jess, I'd like you to talk a little bit about substance use or misuse and how it really fits into the conversation here.
Yeah, thanks. I think, we've already alluded to how interrelated these issues are and how they can influence one another. And I think SAMHSA, the Substance Abuse and Mental Health Services Administration, put out a report a few years ago that indicated that I think alcohol is a factor in over 20% of suicide deaths, and opiates are present in roughly 20% of suicide deaths. And so that's not to say that those substances were the causal factor in those deaths, although in some cases, we know that substances lower inhibitions, they change the way your thought processes work, and so it could be a causal factor. But I think this primarily goes to show that mental health is really complicated, and that issues like anxiety, depression, and substance use are all linked to one another, and their root causes are linked. So you have to, again, look at it really holistically. And I think, when we talk about some of the personal risk factors that we talked about and the work-related risk factors that we talked about, when they combine to impact mental health, that includes substance use, likelihood for abuse, anxiety, depression, suicide, and then the existing mental health conditions can exacerbate those risk factors. They can exacerbate one another, and it creates a sort of cycle. And so, of course, that makes addressing mental health very challenging. But I think that if we make sure that when we talk about suicide prevention, we're not only talking about suicide prevention, and we educate around things like substance use and substance abuse, alternative pain management. I think Justin or somebody mentioned that already, in relation to, the easy path to go from prescription opioids to regular use and addiction. I think it's there's a statistic that 25%, 1 in 4 people can become addicted after only 3 days of use. And so I think, all the court cases, everything that's come out about these big pharma companies and the makers of, opiates, we know inarguably now that they are addictive, but there still needs to be, I think, a lot done around primary prevention for pain management, not for pain management, for injury prevention, and then also alternative pain management methods, things like that, so that we can cut down on the risk altogether for substance use and substance abuse when it comes to opiates. And then we'll also be cutting down on suicide risk. It goes hand in hand. So. And I would just say at CPWR, we have a lot of resources to address both of these issues. If you go to cpwr.com to the mental health section, we actually have 2 sections, one on suicide prevention, one on opioids, and both of them contain a wealth of simple resources. Everything's free. We're funded by NIOSH, the National Institute for Occupational Safety and Health. So everything we put out is free and covered by them. So yeah, I would definitely encourage you all to check that out. And if you're not addressing both suicide prevention and substance use, I think, again, they go hand in hand.
I think the other side of that too is that, Jess, you mentioned, and I think one of the other panelists mentioned also, is that the chronic pain that leads to some of that substance abuse. So Justin, if you don't mind taking a look for us at what that adjacent issue of the musculoskeletal sort of affects and how that can affect mental health as well.
Sure. Thanks for the opportunity. So musculoskeletal disorders are they're actually part of the process that I do a lot of research on at Milwaukee Tool, and our whole company does, because we've really focused on solutions for like top risks, and across the industry, the musculoskeletal disorders, which is caused by repetitive style injuries, is number 3. It's responsible for 35% of the national workman's comp expenditures nationally. 35% goes to support ergonomic or musculoskeletal disorders. So if you look at that in combination with the number was 14,000 plus souls were lost to opiate overdose in the construction industry, and that's in a whole, not just trade professionals, but also as well as leadership. I think if you look at that number combined, that explains like some of the issue here, right? So when you look at it from an ergonomic perspective, substance abuse disorder is people self-medicating to deal with pain, right? And I kind of mentioned that earlier, like that's reality. Like here in Boston, we're learning where people are like, hey, I'll buy 5 Oxycontin pills from someone so I can work all week, make it through each day. And I understand when they have 6 kids, they got responsibility. So it's because the process they went through early on ran out. So I think understanding that process, which is reality, and looking at how it starts, and I think having a good ergonomic program, and I don't mean just stretch and flex. I mean, really look at the deep, pull the onion back, look at the deep processes, start to finish, how heavy tools are, how heavy materials is, moving stuff around. Can you do it mechanically versus manually, that process? And then a side note is And something that Jess mentioned from the CPWR, they have an outstanding paper written on alternative pain management. And what I mean is alternative types of drugs that help with pain management, or even stretching or other process that can be followed besides being prescribed an opiate. And I think that's because that's one of the first things healthcare providers do a lot, is when a trade professional goes to see somebody for pain, muscular, from a musculoskeletal disorder process, they more often prescribe an opiate or some type of drug for pain management, because that's what they're told to do for malpractice insurance and all that stuff. So I think understanding that process and then trying to educate the trade professionals on pain management and alternatives. They have a great paper on the CPWR. I just read it. It blew my mind away. It was in partner with NABTU, I believe. And it talked a lot about the alternatives that are out there. And I think educating trade professionals and management and different leadership people about alternatives is a real huge part of that.
Thank you. Justin just alluded to leadership. So Nick, I want to ask you a question. The conversation about suicide prevention in the construction industry often gets stuck in our HR departments. And obviously we want to move that certainly towards our safety professionals, but more importantly to leadership. So how do we get leadership involved in this conversation, and really start having them lead the conversation about suicide awareness and prevention in construction?
Yeah, so I mean, firstly, it is important that HR are involved. They have access to resources, EAPs, and things like that, and that's great. And for our employees, that's fine, because they can communicate what's available to them, etc., etc. But HR, one, they don't look at the way we work from a point of view of the risks, etc. They don't look at all at our subcontractors, our GCs, anybody that's outside of the employees. So it kind of leaves a huge gap there, because small companies don't have HR departments for a start. So there's nobody then advocating for the workforce. So safety professionals, and like the others on the call, I've been one for decades. And one of the reasons I got into it is because I cross the whole breadth of the business. So I see everyone, right? So, and because of we're all about risk. We're about risk identification, controls, etc., etc. So who better to, one, advocate for it, but also to get others involved, and leadership. Essentially, we have to communicate what the risks are, what the control measures are, how that's going to benefit the organization. I mean, there are so many positives and benefits from managing risk as a whole, total risk, effectively as an organization. And I don't know many leaders that don't know that, but it's just enlightening them as to the impact mental health has on physical safety. And globally, it's become very much more evident. Psychological safety is the new kind of buzzword, if you like, but it's actually, it's more than a buzzword, but there's standards around it elsewhere in the world. ISO 43,000 or 45,003 has a great guidance on psychological safety, and actually gives you some superb pointers towards what you might look at. So the bigger companies are very aware, and actually, like Lendlease, we spend a lot of time educating our subcontractor base on all of these issues, but also at the same time trying to tackle some of the things that can contribute towards mental health issues, suicide, ideation, etc. And we're in a better position than some of the smaller companies, and by getting them involved, particularly the owners and that, and educating them on this. Owners on small companies are much closer to the front line than like the CEOs of Lendleases, Turners, etc. And they're in a great position to help their own people, but they have to know, and they have to see what can they do. So it's about communication, bringing it up, and our safety professionals are in a great position to influence the field teams, the field leadership, and all of those messages will go up through to our CEOs and that, because without resources we can't do as much. Certainly.
Absolutely.
So
Absolutely.
Can I add to that? I've done that in the past, right? With this, and Nick, you hit it dead on, buddy. Both Nick and Wes can probably appreciate this. And I said on the last panel is, for many years, safety professional was looked at as the cop, right? And over the last 5 to 7 years, we've transitioned, I think, in the industry from being that cop mentality to more of a resource that people come to for help. Whether it's, hey, I need your help with this access, or I need your help, right? So whether it's medical or mental, I think a lot of people see us as a positive resource. And not to sound bad about, get say all my HR peeps that are out there listening, but they're sometimes looked at the more enforcement or the bad people when they come up, and they're not as connected. So I mean, they're very vital part of the team because they do understand and know the resources available. However, I think safety professionals are in the trenches with the trade professionals. They see and work with them each and every day, and they're looked at a positive light. And I think that gives them an opportunity to recognize differences in people and their behaviors, and opportunity to actually have real world conversations with them if signs, symptoms, or if they ask for help. Taking courses and being prepared on having those conversations and being able to get them to help is very key.
I want just to add real quick, because I mean, Nick touched base on one thing there that I think is important for everyone on this call to understand. And that is, number one, those presidents, CEOs, owners of those small companies, they are the leaders of risk management within their organization. And they recognize kind of what's going on. And it's that safety culture. CPWR did a great study on safety climate and safety culture about the difference between a small contractor and a large contractor. But when you look at that relationship, safety has to have a relationship with HR, and HR has to have a relationship with safety, and understand and support each other. And I think that that's one of the things, because as Nick said, you don't have an HR director for a company that's got less than 50 employees. It's somebody's making that decision. And often it is the safety professional. And to Justin's point, going from the safety cop to the safety supporter, I think is an excellent analogy of where we're transitioning when we start talking about health and mental health, and why we're concerned, because, hey, we know there's a workforce shortage out there. We need to do what we can to keep our employees healthy.
I think those are all great points for sure. And Wes, you mentioned, doing everything we can to keep our employees healthy. And part of that is breaking down the stigma in this conversation. So that's where I'd like to throw out the next question to all of you. And that is, what can employers, both big and small, do to help decrease this stigma and build awareness around mental health and suicide prevention in the workplace? So if you don't mind, Jess, I'll have you start, and then I'm just going to kind of go around the screen here.
Yeah, I was going to jump in first, even if you didn't call me.
Perfect.
I think just first and foremost, talking about it, having the courage to talk about your own struggles, having the courage to ask someone if they're okay, just talking about mental health in general, even if it's just bringing up some of the statistics that we've shared about how prevalent overdose and suicide is in the construction industry. I think talking about it is the only way to break down those barriers, and being the first person to bring it up is the hardest. That's a tough position for anyone to be in. It takes bravery, but I think all of us on this panel have found that if you have the courage to start the conversation, there are people that absolutely want to jump in, and that have their own experiences, whether they've been touched personally by mental health struggles, or they know someone close to them that has, most people, especially after the pandemic, and since the pandemic, have been touched in one way or another by mental health struggles. And so I think really just starting the conversation is the biggest hurdle and the biggest thing that can make a difference. And I think being in leadership sometimes means that you have to be the one to do that. And I know, at CISP, we try to make that as easy as possible by providing some resources to start the conversation, to make the pledge to prevent suicide. And I think doing something like that, making it a little bit more official as part of a regular safety and health outreach and education effort can sort of stop any argument in its tracks. If it's part of your safety climate, if it's part of your safety and health program in general to talk about mental health and mental wellness, then it just becomes a lot more matter of fact and kind of par for the course. And I think that's really how we address stigma.
I think it's a great point.
Colleagues may have some other ideas as well.
And it really shouldn't be just 2 months of the year, right? It's not just about May when we're talking about Mental Health Month, and it's not just about September when we're talking about Suicide Prevention Month. How about if we go to Nick now?
So I guess people looking from the outside into a big company like Lendlease would say, it's easy, you've got all the resources, etc., and there is an element of truth to that. But I would suggest that the kind of model we use and the way that we engage and embrace this particular issue, it would be the same. And it starts with awareness, and it's not just awareness for the people on the tools or in the office, etc. It's leadership. So if I just explain a little bit about our journey recently here in the US, which was part with CIASP or CIASP, 3 years ago, just coming out of COVID, coming into COVID. So we came up, a steering group, advocates. So you need people who are interested and want to get involved, and you like-minded people. And then you look at the problem, you look at the issues, and then you look at what can we do practically, and you come up with some ideas. Then you got to sell it to the leadership, whether that's a small company or a big company. You got to sell it to the person with the purse strings, the person that controls the money. So you come up with a story, you come up with this is what the problem is. So these are the stats, etc. This is what the issues are. And this is how we think that this organization can help to tackle some of those issues. And this is what it's going to need. And again, it will start off with awareness. So there are lots of free resources out there, as you mentioned, as we have on CIASP, we have some training. When I say training, it's free, with Living Works, it's a 60-minute online, and it gives you some tools to be able to help somebody who's struggling, identify when somebody's struggling, etc. So starting off with those kind of things. And we have Toolbox Talks on there. So Lendlease uses, and we put this out into all our projects, Toolbox Talks about general awareness. We have a 60-minute, which gives people that awareness, but also some tools to help. We then have a 3 to 4 hour session that provides supervisors with even more tools and a deeper understanding of the issues and what they can do to help, and also keep people safe until they can connect them to somebody who has even more tools, still isn't a professional, counselor or, psychiatrist, but who is better placed to keep somebody safe, work with them. This is what we call an assist worker. Keeps them safe, works with them to come up with a plan to keep them safe until they can get that professional help. So there's kind of levels, and wherever you are, whether you're a small company or a big company, you start at the same level. Start with the awareness, and then it builds from there. Get advocates, identify advocates, empower them to be, an advocate and to get involved, and then and go from there. So I would say start with awareness and move forward.
How about you? Give us your thoughts on decreasing stigma.
Well, I think one of the things, and Justin even mentioned earlier, one of the things about decreasing the stigma is we have to show our own vulnerability. We have to share our own stories. And each one of us, we have stories that relate to what we're talking about here today, to talk about mental health, to talk about it, death by suicide by people that we know. I mean, when you start looking at that and having these advocates that actually can go out and interact with the field, that this is how a company can actually start the conversation. Because my biggest thing here a lot of times, and I will say this is a perfect opportunity to say it. Somebody comes to your mind that you haven't seen in a while, somebody you worked with. Think about that. You don't know what the connection is through the universe, but if that person's on your mind, how come you don't pick up the phone and make a call and say, hey, how you doing? I thought about you today, and I know you went through a divorce last year. I know you changed jobs, and why don't we encourage people to reach out? And the same thing with on the job. We've got to have a better communication between people on the job. Hey, what are you doing? What's going on this weekend? Hey, what are your kids doing in high school, and are they playing football? These are the kind of things that when we find out what people motivates people and we understand what the conversation is, we can actually have a person-to-person conversation and not just get this job done. And I think that that's really how a company can break down the stigma and give people an opportunity to show my vulnerability, because I've had things happen. I've had people that have died by suicide that I've known. I've had people that have died by substance abuse, overdoses. I mean, I know that. So I can share that with people from my personal perspective. And, I had an opportunity just last week where somebody actually, I was, checking on something, and the lady told me, she says, it's been a rough week. My daughter attempted suicide. And I'm like, Catherine, remember, this is what we're doing. Hey, if you need to talk to anybody, she was one of the people that really welcomed me into the DC community when I moved to DC years ago. I'm here for you if you need a conversation. That's what we have to let people know. We have to let people know we care, and we care about them. And if they need to talk to somebody, hey, give me a call. Justin?
Thanks for saving me for last. Everybody, had some great input there. It's hard to add, but I think, going through my own process, I thought I was prepared for anything that came my way, right? So, but I learned quickly that I was not. So I think understanding from whether it's a leadership all the way down to a first day employee, that there is the risk involved in the construction industry that focuses on mental health awareness, right? So I think from my perspective, and utilizing resources from the CISP, it's very important to set up a proactive approach. Talk about it early before you have to be reactive to an incident. And that's something I think that from even a safety professional perspective, and even leadership, it's important to understand, like, more companies react after an incident, and it's usually not good, right? So let's take a different approach, especially on something so vital in this life, and that's be proactive, set up preventative measures. I talk a lot about self-care. I've seen a lot more lately. From a leadership perspective, it's something that's free. You can talk about peer groups, using a peer group. It's okay. It's a couple people to talk about what's going on and challenges, and they feel like they're not alone. And then, there's other things you can do, whether it's writing in a journal, physical fitness, whatever it may be. But from a leadership perspective, setting that expectation, driving that in your culture, it's something that could be the changing point that leads to not only more people globally feeling like they're in a solid place to work, but they know they're cared about. So from a proactive approach, I think that's a good way of kind of looking at stabilizing the mental health process in any company.
Thank you. All right, so we are getting close to ending our time together, but I want to end with a two-part question, and then we'll open it up to anyone who might want to add something into the Q&A for us. So final thoughts would be this. This is what I'm going to ask. What is the one thing a company can do to get started? And then share with us your favorite resource. So I'm going to actually let's start with Wes on this one, if you don't mind. So the one
Okay.
thing a company can do to get started, and then your favorite resource or resources.
Well, I think the one thing that a company can do to get started is look for opportunities to create these group training sessions, these group settings, because when we get together in a group, maybe we're going to offer a financial benefit class. We're going to offer, a relationship class. We're going to do something that we're going to provide people, it's even a leadership program, because there's a lot of questions that we have about leadership. Let's have some leadership training to where we're going to bring people in and start the conversation. Because I think that when we start looking at that, and we then are able to introduce some of the resources, and there's plenty of resources out there, and I'm going to give some other people a chance to talk to them. But first off, I'm going to say preventconstructionsuicides.com for the CISP. You're going to find many links, and as Nick and Justin and Jess and Sonia have already said, we have plenty of safety talk, we have plenty of toolbox talk, we have plenty of information that you can glean from and share with your employees. And then the other thing that, as one of our other board members who I know, and worked with over the past few years, Greg Sizemore, and I were on ACOSH for 2 cycles. I was on ACOSH with him for 2 cycles. And one of our emphasis programs there was bringing mental health awareness to OSHA. So, when one of our conversations, we actually had an ACOSH meeting, and the very next day, coincidence-wise, OSHA has an OSHA.gov page on preventing suicides. So OSHA has a lot of resources, and they're really getting into this realm, and their resources will provide links to the CIASP. They'll provide links to Living Works that Nick talked about earlier. They're going to provide these links. So I think that's really where a company can go to, granted, we can do an internet search, but OSHA.gov, preventingconstructionsuicide.com, these are 2 of the greatest resources you can get started with. But there's a wealth of information out there, and don't delay.
Whoops, I went off mute. Jess, how about you? One thing a company can do to get started, and your favorite resources, other than CPWR.
So, I think we could talk about the training and all of the stuff that is needed to get started. And I think my colleagues are hitting on that. I'm going to take a slightly different approach and say that, Russ talked about building relationships and building trust as a way to reduce stigma. And I think that it also applies to not only stigma reduction, but also just to addressing mental health in general. It's so much easier to accept help from someone that you already know and trust. So I think, if you don't already have team building exercises or, bowling nights or things like that built in, I think focusing on relationship building is actually a really great start before even tackling the mental health conversation. And my favorite resource, since I already talked about CPWR's mental health section, I'm actually going to take this opportunity to plug bestbeltplans.org. Best Belt Plans is CPWR's manual materials handling, planning, and training resource. So it's actually a whole collection of resources. There's a whole planning tool that takes contractors from the pre-bid stage all the way through a project to consider how to reduce manual materials handling. And so this is a really good tool for primary prevention of injuries that lead to opioid use and misuse. Again, that's bestbuiltplans.org.
I'm going to call on Justin, but I saw him scribbling down that bestbuiltplans.org himself. So go ahead, Justin. Tell us where do companies start, and what's that one resource?
Yeah, sorry for the scribbling. It was just writing myself a note to send something to Jess that she's been looking for a couple months probably now. Anyhow, so first and foremost, I think it's very important to start now. A lot of people, like I said before, wait and they don't get leadership involved until leadership comes to say, hey, we got to do something. And it's usually reactive. So taking a proactive approach, very important, I think, prioritizing that self-care, leadership involvement, and peer groups is really important. I run 2 peer groups. Anybody that wants to ever be part of them to learn what they do and or be a part of it, it's really helped me. It helped save my life. So I think it's important from a mental health perspective. And then from a resource process, besides the CISP.com, or I've said that wrong, but go into CISP. One of the best courses that I've taken so far, and I can only talk about courses that I took as an experience process, was VitalCog by Dr. Sally Spencer. It was so dead on, from especially the process I went through. It really prepared me to understand a little bit better about having conversations, and it actually helped me cope with my own stuff. So I just wanted to say that it was a good course for people looking to start an actual process in their company. Good learning starting point. So it provides good resources. So that's my answer.
Awesome. Thank you. Nick, how about you?
So first off, I'll just talk about resource because Justin just mentioned one, VitalCog. Lend-Lease were actually involved with that right at the start with Sally Spencer Johnson, whatever.
Sally Spencer Thomas.
Yeah, with the Johnson Depression Center in Colorado. It's great, and the idea is that it enables organizations to be sustainable in this space, i.e., it's a train the trainer program. So it enables you to put a couple of people or more, whoever's interested, on it. Yes, it does cost, but it's from a point of view of impact and for cost, it's great value because it enables them to then go out and train your own people plus others on this very important subject. So that is one resource that I had forgotten actually for the moment. So thank you, Justin, for that. From a leadership perspective for me, and what I would want is more, what's the word? Just vulnerability in our leadership. So CEOs, they give out messages, broadcasts, all the rest of it. And if you read them, then you're probably a better person than me. But when I have read them, and when the ones that have been the most impactful are the ones, as we've all mentioned here, is about personal stories and just making it personal. And if you can get, and they will have personal stories, I can guarantee, on this subject, mental health, suicide prevention, and just add that into the lexicon that they use when they're communicating. And it doesn't have to be every time. I mean, in safety, we used to say, safety had to be number one on the agenda and all the rest of it. I don't actually agree with that. I think it's equally important as everything else, as is health, but it needs to be there. And when it's absent, it's very noticeable. So just get it on the agenda and talk about it, with authority and compassion and humility.
Thank you. And thank you, panelists. I know we do have some questions in the Q&A. Just to wrap that up, I will include some of my favorite resources. I think that it's important to be able to get access locally as well. So I would recommend your local chapter of the National Alliance of Mental Illness, as well as the American Foundation for Suicide Prevention. They can both be reached at afsp.org or nami.org for NAMI.org. I'm going to go to our Q&A and ask my panelists to answer some of those questions. It looks like Justin answered them in writing, but that's okay. So I'm going to answer them out loud just in case someone else missed them. Someone says they are interested in hearing more on trainings like QPR, mental health first aid, or Living Works Assist. are there other recommendations for trainings that are out there and thoughts on mandatory versus voluntary trainings? So I know that Justin did give an answer there, and he suggested that VitalCog is a great resource, and voluntarily putting those out there is a good option. Does anyone else have thoughts on QPR training or any other training that's out there?
The mental health first aider is very good. That's an 8-hour. They do it online as well now. Since COVID, they didn't used to. It used to be face to face. It can still be face to face. That's excellent. I've been on that, and we run that out for our employees, and we've got probably thousands that have gone through it on the voluntary or involuntary, like voluntold. I'm kind of mixed on this because I've facilitated workshops where people have been told to be there so many times that it's normal, and some of those people that didn't really want to be there have provided the most input and also got the most out of it. So yeah, if you want someone to be an advocate, give them the chance. If it means telling them to be there, that's okay, but that's as far as it should go, in my opinion. If they don't want to be involved after that, then great. But just the awareness and everything, that's just my opinion, obviously. But yeah.
But I do think from one perspective, when we talk about field leadership, we talk about supervision, and we talk about foremanship training for the trades and everything else, there's a certain aspect of this that we need to include some awareness training for our leadership, because it's one of the things that and I think going back to these classes where VitalCog has a trainer to teach somebody to go out and teach people on the job site how to talk this, how to have this discussion and what are the questions to ask. And sometimes, it goes back to sometimes there are uncomfortable questions that we need to ask. And if we stay in our comfort zone, we're never going to accomplish anything. We're never going to grow. And I think that from a standpoint of leadership, when we help these foremen, when we help these supervisors and these field supervisors understand that, from a soft skill standpoint, from a management standpoint, from a motivational standpoint, it's a very important part of their job. How do they get their workers engaged and involved in doing things? And it goes back to, like Nick said, the vulnerability of the leadership. Vulnerability is a key factor in getting support from everybody else.
Thank you. The next question Oops, go
Sorry.
ahead.
I just wanted to add one caveat since we're talking about mental health here as the topic. And I think this applies to any training and who's going through it. When you're thinking of leadership, keep in mind that there's a possibility that they are currently struggling, and that going through a training around suicide prevention might not be the best thing for them at that time, depending on what's going on in their lives. And so I think be open to a conversation to ask them if they are willing to go through the training, and give them the opportunity to just maybe delay it if it is not the best time, if something's recently happened or they're recently struggling. Just be cognizant of that, since we're in any of those trainings, and I've heard good things about all of them that were mentioned, actually. They're all going to touch on some tough subjects, especially the ones that go more in depth. So.
One of the things
Great point.
that's always part of that, well, the training certainly that I've mentioned and talked about, is having the support there, organized and communicating should anyone have a triggering moment or whatever. So you're absolutely right, Jess. Totally agree.
So the last question that we have is, can you recommend where to get training for our foremen and managers to help start the conversation about mental health with our employees? The culture has to start at the top. And I will say that before we got a chance to answer, although Justin did mention VitalCog there, that Macy jumped in and suggested preventconstructionsuicide.com, and that's our training tab. So way to go for that. Thank you for the support there. But you're right, exactly. And I would recommend our toolbox talks there. And there is a facilitator guide to those toolbox talks, but also on our website, you can go to our Living Works training and request 5 free logins to be able to take that training. It is a 60 to 90-minute conversation about training about starting the conversation. So please feel free to check out that resource as well. I don't know if anyone else on the panel has anything else they want to add there before we wrap up, to be respectful of everyone's time.
Just one thing, I'll put a call out for big companies like Lendlease. If you do work for big companies, they have things available. We run them all the time, right? And we struggle to get people to attend. So what I would say is, if you're offered it, make use of it, because it's not free, because you've got to give your time, but that's all you're giving. It's organized, it's there, and we even feed people. So, just get involved and get there.
Thank you. And thank you, panelists, and thank you, audience, for joining us today. We appreciated your time, and we appreciated the opportunity to have this conversation with all of you. So again, have a great day, everyone, and enjoy your holidays. Take
Thanks,
care.
everyone.
Thank you, everyone. See you.